Okay, hi, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment. This is where the meniscus is torn. We'll take a probe just to show you. I'm trying to focus the camera. It's a little bit hard because I think we have something. So here's our probe coming in. The tear starts right here, and it's an undersurface tear. I'm basically hooking it right there. You can see how the meniscus buckles there when I hook it. So that's the tear. Of course, we talked about repairing it, and we opted not to do that for a lot of reasons. But I just wanted to show you this is the area that we're going to start trimming back right about here, because right there is where the tear is. Okay, so we'll show you some more in a little bit. Biter. Okay, so we've taken out the part that's torn. It's primarily the posterior horn of the meniscus that we had to deal with. We're going to continue to smooth things out a little bit, but that's essentially the end result. The tear really extended around quite a bit into the body on the undersurface. And so we're just doing our little fine tuning here, and I think we're pretty much done. Okay, so this is the central part of the knee. That's the anterior cruciate ligament there. That looks good. It's a little bit of a structure called the ligamentum mucosum blocking our view a little bit. But with that removed, we get a pretty good look here at the notch. We're going to peek in and look in the lateral compartment next, which is going to be over here. And the anterior horn of this lateral meniscus looks pretty good. Hold that there. We'll show you some more in a minute. Okay, this is the lateral compartment. So the lateral meniscus looks good. The articular surfaces look pretty good. Some minimal radial fraying on the inner edge, but that's really nothing to speak of. Doesn't require any major surgery. We're going to look at the notch next. I'm sorry, at the patellofemoral joint next. We're going to probe this lateral meniscus and make sure there's nothing that needs to be done there. Okay, so this is the patella at the top of the screen. There's a few little wear and tear changes that we're seeing, but not bad. Okay, as you come over here to the lateral facet, that looks pretty good. Medial facet here looks pretty good, and the trochlea, as we track it all the way down the front of the knee, also looks pretty good. There's nothing down the medial gutter, so make sure there's no meniscal fragments to worry about. And then we'll take a peek down the lateral gutter if we can sneak over there. And there's some loose pieces that we do want to remove.